Welcome to this explainer. I am so glad you're joining us, because today we're stepping into the truly incredible and honestly kind of cinematic world of kidney health. As a specialist guiding you through this material, I really want us to take a close look at the phenomenal work our kidneys do completely behind the scenes. They are, without a doubt, arguably the most underappreciated organs in the human body, just working tirelessly 24/7 to keep our internal environment perfectly balanced. But, what happens when that balance starts to shift entirely undetected? Well, that is exactly what we're going to explore today.
Okay, let's dive into this. Dr. Joseph Vesalotti, who is the Chief Medical Officer at the National Kidney Foundation, perfectly frames our discussion. He points out that chronic kidney disease, or CKD, is essentially a silent mystery happening deep within the body. The stakes here are incredibly high right from the start, mostly because you literally cannot feel your kidneys failing. By the time symptoms actually force someone to finally go see a doctor, the disease has usually progressed to its very late stages.
To truly wrap our heads around the sheer scale of this, let's look at recent data from the CDC. We are talking about an estimated 35.5 million adults in the United States alone living with kidney disease. And globally, it affects about 13.4% of the entire population. But here is the most staggering part of that statistic. The vast majority of these individuals are completely unaware of their condition. It is quite literally a massive, silent health crisis happening right under our noses.
Now, to understand the disease itself, we first really need to appreciate the majestic function of healthy kidneys. I want you to imagine your kidneys as microscopic, highly advanced filtration plants. They do so much more than just make urine. They are continuously filtering your blood to remove toxins and metabolic waste. They're perfectly regulating your fluid levels. They even release hormones that stimulate the production of red blood cells, and they play this absolutely critical role in controlling your blood pressure and maintaining the strength of your bones. They're basically the master regulators of your entire internal chemistry.
But of course, our bodies are deeply interconnected. In medicine, we actually call this the cardio-renal connection. It turns out the leading threats to these highly advanced filters are traditional cardiovascular risk factors, specifically high blood pressure and type 2 diabetes. When someone has uncontrolled blood pressure or consistently high blood sugar, it causes progressive, permanent damage to the fragile, tiny blood vessels inside the kidneys. Over time, those little vessels scar up and just lose their ability to filter effectively. And this brilliantly illustrates what that damage looks like on a microscopic level. Think of your kidney as a finely woven sieve. A healthy sieve keeps all the important things like your red blood cells and a critical protein called albumin safely inside your bloodstream while only letting the waste pass through. But when that kidney is damaged by high blood pressure or diabetes, the holes in that sieve, they get bigger. It starts actually leaking albumin into the urine instead of keeping it in the blood where it belongs. That leakage is our very first major red flag.
So while the early stages are practically silent, as the disease progresses, the gradual buildup of impurities and uremic toxins does physically manifest in the body through some subtle clues. For instance, because the kidneys aren't signaling the body to make red blood cells, severe fatigue and weakness set in due to anemia. Toxins hanging around in the blood can cause severe sleep issues like sleep apnea. A loss of mineral balance leads to this incredibly dry, itchy skin. And because the body just isn't processing fluids and sodium correctly anymore, patients often notice persistent puffiness around their eyes or real swelling down in their ankles and feet.
Right alongside those physical signs, there are crucial urinary changes to watch out for. You might find yourself urinating a lot more frequently, particularly having to wake up in the middle of the night. You might even notice blood in the urine, which happens when those damaged filters start leaking red blood cells. And one very specific, fascinating sign is persistently foamy urine. We're talking about excessive bubbles that take multiple flushes to actually go away. This foam often looks exactly like the foam you see when you're scrambling eggs, and that's simply because the albumin protein leaking from your kidneys is the exact same type of protein found in eggs.
Now, because a lot of these signs can easily be mistaken for everyday issues like being tired or just drinking too much water before bed, the only true way to solve the mystery of chronic kidney disease is through specific testing. The medical community relies on two diagnostic pillars here. The first is the eGFR, which is a simple blood test that estimates how well your kidneys are actively functioning and filtering. The second is the UACR, a urine test that actually measures the amount of albumin leakage, which tells us the level of physical damage to the filters. Function and damage. You really need both to see the whole picture.
So, how do specialists officially stage the disease? We use the global KDIGO guidelines.
Basically, if your eGFR drops below 60 for more than 3 months, or if your albumin ratio in the urine stays above 30 for that exact same time frame, you are officially diagnosed with chronic kidney disease. And it's a sliding scale. The lower that eGFR number drops, and the higher the albumin leakage goes, the higher your risk becomes for severe cardiovascular events and complete kidney failure.
Section: Breakthrough Medical Treatments, Shifting the Tide Against Kidney Disease Progression.
Now, what's really interesting about this slide is how much modern medicine has evolved. For years, we relied pretty heavily on ACE inhibitors and ARBs to control blood pressure and protect the kidneys. But recently, we discovered SGLT2 inhibitors. These drugs were originally invented just to manage diabetes by forcing excess sugar out through the urine. However, researchers accidentally discovered that these medications are arguably one of the greatest inventions for slowing kidney decline, even in patients who do not have diabetes. It's incredible. They remarkably slow the loss of kidney function and drastically reduce hospitalizations for heart failure, a real game changer.
Beyond those pillars, we're stepping into the truly incredible future of personalized medicine. We now have FDA-approved, highly specific drugs for rare diseases like IgA nephropathy and FSGS, which target the exact pathways causing the scarring. There are even targeted therapies in development for a specific genetic link found in 10 to 15% of African Americans with CKD. But, a quick aside here, while stem cell research shows immense promise for the future, I have to give a firm warning. Heavily scarred kidneys cannot simply be reversed by some online fad or supplement. Please, don't fall for the internet miracle cure hype. Always trust proven, heavily researched medical science.
Even with all these amazing advancements, we do have to talk about what happens if the disease progresses to the very end. When the eGFR drops below 15, we reach stage G5. That is kidney failure. At this critical threshold, the kidneys just can no longer sustain the body on their own. Toxins build up to fatal levels, and advanced, life-saving interventions become absolutely necessary.
The first of those interventions is dialysis, which artificially cleans the blood. But it's empowering to know you have real choices here. In-center hemodialysis involves going to a clinic 3 days a week for several hours. The trained staff manage everything, but it does come with strict diet and fluid rules. On the flip side, peritoneal dialysis, or PD, is actually done daily in the comfort of your own home. It uses the natural lining of your abdomen to filter blood, requires absolutely no needles, and offers a lot more flexibility and freedom to travel. Understanding the day-to-day reality of these options is totally key to maintaining your quality of life.
The major alternative to dialysis is, of course, a kidney transplant, which can offer a significantly better quality of life and longevity. However, it's a major surgical procedure. The rigorous evaluation process requires patients to meet some very strict overall health and mental wellness criteria. For instance, patients need a highly dedicated caregiver support plan for the weeks following surgery. And unfortunately, folks with active cancers, advanced heart disease, or certain active infections are excluded from this option, which makes preventative care all the more vital.
So, the crucial point is that prevention and early action are everything. Based on the KDIGO clinical guidelines, here are the practical, everyday steps you can take to protect those beautiful filters of yours. Relentlessly manage your blood pressure and blood sugar. Try to maintain a low-sodium diet of under 2,000 milligrams a day to reduce fluid retention. Stop smoking, for sure. Avoid the prolonged use of over-the-counter NSAID painkillers, like ibuprofen, which can actually harm kidney blood flow. And most importantly, if you have high blood pressure, diabetes, a family history, or you're over 60, you absolutely must get tested annually. Which really just leaves us with this one vital question. When was your last eGFR and UACR test? Kidney disease doesn't have to be a silent mystery. You have the power to uncover it before the damage is done. Take ownership of your health. Ask your doctor for these 2 simple, life-saving tests and protect the incredible organs working so hard to keep you alive. Thank you so much for joining me in this explainer today.